this is a risk that is modifiable via lifestyle. So you're better off finding out about it than just being blind, because you could have avoided the outcome if you knew ahead of time.
Hey, let's talk about that transition, because when we think about interventional radiology and we think about functional medicine, there are almost two different ends of the spectrum. Tell us about the transition, that point, wow, where you say, you know what, I don't like, I see a different focus, and how you've run with it.
We have to go to right before medical school, where I was doing a lot of research with my dad, who is an immunologist, and that's all in the field of preventative immunology. So his focus has always been, how do we identify autoimmune conditions early, find out where they came from, kind of backtrack that process. I go to med school, do my own thing, picked radiology because, quite honestly, I liked everything in medicine and I couldn't really figure out one field that suited me. And in radiology, you have to know a lot about a lot.
Yep,
so that appealed
definitely.
to me. Ended up really missing the patient care part of it. So picked IR as a fellowship to get some more hands-on care, like the procedural part of it. Finished fellowship, which was, very intense. And then made it into private practice and was working at a bunch of community hospitals in LA. And, I think the reality of hospital-based IR is that you're doing a lot of end-of-life care on people who have really serious chronic diseases. I mean, almost all of the patients, had dementia, end-stage renal disease, diabetes, cancer treatments. And it felt a lot like I was using a tremendous amount of resources, both mentally and also physical resources, to kind of patch up something that was already lost.
Right. Sometimes it's tough to see beyond that, right? We can keep people alive for years and years and years and years, but when you look at, functional living, and it just becomes a different mindset for any physician.
Yeah, I mean, half the time I wasn't consenting the patient because they weren't able to give consent. I had to go to a family member. So it's like, what was the point of that? Would really sit in the back of my mind a lot. I had a hard time with it. And, it was just about the time that I was, I was engaged, about to get married soon. And it was, kind of a now or never moment for me. And something intuitively in the back of my mind just said, make a switch, do something else. And, functional medicine kind of caught me, because you go and intervene on the exact opposite end of that timeline. You're working with everybody for early identification and prevention. And that really spoke to me. And I called the head partner and said, even though I'm, the highest earning IR doc in the practice right now, I'm going to make a pretty shocking switch. And I left.
Wow.
And just opened.
How did they take that?
Oh, everybody, including them, family, friends, pull me aside and basically say, are you sure you want to do this? You're making what they would call a crazy decision at that time.
Yeah.
And how long ago was that?
8.5 years ago.
And do you regret it?
Absolutely not. It was the best decision I ever made.
And did you open up Regenera right away?
I did.
You did?
I did.
And tell us a little bit about Regenera. Tell us about your clinic and really what a patient can look for and why they would come to see you there.
Yeah, so it's a clinic that's really niched in trying to help people with chronic immune and inflammatory conditions, whether it's a known diagnosed autoimmune disease or whether it's something in the immune dysfunction realm that isn't being diagnosed elsewhere. They come to us for, I think, the very deep personalized dive on what exactly is going on. And more importantly, our job is to create a roadmap for them about how do they walk themselves out of this and back to as healthy as they possibly can be.
And I assume you obviously don't do the same cookie cutter for everyone. Everyone gets super personalized and depending on what their problems are, you go down that road with special blood tests and imaging or whatever it is. If somebody came to you and was healthy, right? Just wanted you to be their functional medicine doctor. You do that too as well.
Of course. Okay. Yeah. We get people who come in all the time and just say, doc, I need you to give me a top to bottom look, see where my strengths and weaknesses are. And we absolutely do that.
And I feel like people are looking more and more towards functional medicine doctors because, you think outside the box. It's not the conventional, allopathic route to, if you're sick, here, take this. Or if something's not feeling well, you actually will be like, no, let's see what the problem is and let's see what's causing it and go from there.
It's funny. I think to go along that same vein, I think we're starting to see more and more of this, even on social media and things like that, where we're trusting less and less in the current big pharma system. And we're looking for, they throw the term out, biohacking and all of the things to try to extend longevity. But we're looking at how certain medicines now have affected us, how vaccines have affected us, how, I think this is where functional medicine really takes over, because we're using some alternatives to heal someone.
Absolutely. I think functional medicine is part of this bigger movement in health in, let's say, the last 10 years, really picked up in the last 5. And I see it as an entirely grassroots, publicly pushed health campaign. The people out there are enabling themselves to grab a hold of the steering wheel of their health with all the information out there and seeking these things out.
But the nice part is you're an allopathically trained medical doctor. Yeah. So unlike a lot of people that are doing this type of functional medicine that can't give medicine, that don't really, I don't want to say understand, but haven't been trained down medical school path and understand, you can treat them with regular medicines, you can treat them with herbs, you can treat them with different types of treatments that other people can't. Now, with that said, how many of these people that are coming to you, younger, between 30s and 50s, coming to you for functional medicine and are really looking to extend their lifespan? And they're really, more than anything, are like, listen, what can you do to help me live longer?
We get a decent amount of that now. Obviously, I think with all of the interest, again, in the public for longevity-based medicine, there's a decent amount that comes through the clinic for that specific purpose.
And what's your kind of, how do you go about it? What's your approach to this longevity medicine, or some of the biohacking that's going on, and people coming and saying, I'm on 17 different peptides, I'm doing TPE, I'm going down to get stem cell. Like, what are your thoughts about all of this across the board? Is it overkill? Is it really doing something? Is it individualized? What are your thoughts?
It definitely depends on the person. I think the most important thing that we talk about initially when people come in is you have to nail the basics. If you're not sleeping, if you're not moving, if you're not eating right, all the other stuff to me seems pointless. And then the next thing we do is really that very, very deep dive into what the data says about, where the good and bad is happening for their bodies. We do extremely in-depth immune analyses on these patients. And, to me, I see the immune system as the focal point of longevity. You can make a strong argument that everything, whether it's cardiovascular disease, cancer, neurodegenerative disease, the things that you worry about limiting your lifespan are all immune derived. So when we really focus the longevity effort on the immune system, you can very often have a lot of downstream benefits. So I think that's the thing that we do that a lot of other longevity clinics that just kind of do the cookie cutter version of it, we do it differently.
And you and I have had a side conversation about this, and John and I, we have the Proactive Longevity, which is in Cabo, which we have a regenerative medical clinic, but we also do therapeutic plasma exchange here. And we had this whole long talk about it. What are your thoughts about doing it for healthy people? And also what are your thoughts about doing it for people that are sick? Because we talked about this, about the people that are sick and how it can be a little bit detrimental.
Yeah. Well, TPE is becoming incredibly popular. I think you guys are among a small group of clinics here in Los Angeles that do offer it, which is amazing, but there's definitely huge interest in it. And I think that's because a lot of people are talking about it in two different spaces in my experience. Number one is just the direct healthy people longevity space, as you mentioned, and it's become a very popular treatment for long COVID and autoimmune disease in general. So let's talk about it in the unhealthy population. Let's say long COVID first, maybe other autoimmune diseases. It's very traditionally been used in autoimmune disease for a long time. I would say the vast majority of patients in that space feel dramatically better after doing a few TPE sessions. It definitely depends on, I think, the chronicity of their inflammatory or autoimmune condition, whether that condition does have some autoantibody portion to it. But, I'd say the majority of people really benefit from what I think of as an immunological reset or rest that comes from that TPE. Essentially, before doing that therapeutic session, they've got an immune system that's extremely aggravated, and in that aggravated state, attacking their tissue and their cells, keeping them from functioning. So when you kind of pull that off for a period of time, it provides an immune reset, a symptom reset, just gives them a really nice place to be able to continue their forward progression. On the longevity side, I'd say, it's interesting that we're seeing more and more use for that now. What that exactly does for the future, I'm not sure. We'll have to see. But I think in theory, it makes a lot of sense because again, if you break down all of the diseases we talk about, cardiovascular disease, cancer, neurodegenerative disease, autoimmune diseases, they're chronic inflammatory in their nature, right? So by doing TPE, you're creating, again, a window in which that chronic inflammatory state is pulled off. So it makes a lot of logical sense to me that they are going to see some benefit from that in the long run. Now, on the flip side, there are a small percentage of patients, particularly those with certain autoimmune conditions, that do poorly after a TPE session. And that's because there's something about that immune cascade that's keeping them afloat, actually. So when you pull that off, they can actually, for temporarily, have a short-term deterioration. I can only think of a handful of cases I've seen in my time where that happened, but it does happen to a very small group of people.
It's interesting to know.
And because ultimately it pulls away antibodies, right? And so it pulls away your protection. So at least for a few days, there are certain types of antibodies that you lack.
For sure.
So it kind of depresses the immune system for a short term. In the majority of people that are coming to have this done, it's a great thing. But I totally agree. I mean, there are some patients where it's detrimental.
Yeah. And it's hard to pick who that's going to be ahead of time. Luckily, when it is detrimental, it's temporary. As soon as their immune system rebounds, they tend to get whatever they lost back pretty quickly.
You also brought up long COVID, and I think that's kind of important because there's a lot of people that are kind of struggling with that.
Yeah.
And therapeutic plasma exchange has been beneficial. Is that something that you recommend to your patients that have it?
We see a lot of long COVID patients in the clinic, and our long COVID workups, again, are very personalized. The foundation of long COVID is really kind of understanding in what buckets the individual falls in, because it's a whole spectrum of potential. You either have issues with persistent viral infection from SARS-CoV-2, or what we call viral reactivation with things like Epstein-Barr virus and HHV6. They could have leaky gut. There are certain autoimmunities that can occur after long COVID. Mitochondrial dysfunction can happen. So, the first part of it is really identifying what part of those buckets you fall into. And let's say there's a viral issue happening, either persistent SARS-CoV-2 infection or viral reactivation. I always say you need to make sure you take care of that part first. But when that's taken care of, or if it's not part of their spectrum of issues, TPE can be beneficial for sure. Again,
awesome.
If you think about it, like we talked about, it temporarily pulls the immune system back. If part of the issue is that they're still dealing with that pathogen, that virus, and all of a sudden you pull their immune function back, that's the group that can plummet. But once you take care of that part, which is actually not very difficult, TPE tends to be a really nice breather for the immune system, and they rebound.
How do you take care of that part?
Well, we don't have any real medication to take care of it. Let's say that pretty clearly right now. There was a trial for the presumption of SARS-CoV-2 persistence and using an extended dose of Paxlovid at Stanford. And it actually showed no benefit as far as long COVID is concerned. So it doesn't look like using Paxlovid as an antiviral makes a huge difference. We use a lot of high-dose IV vitamin C in our clinic, actually, and find that very helpful for patients, maybe somewhere between 4 to 6 rounds of it. And whether it is SARS-CoV-2 or EBV or HHV6, it tends to work almost immediately for them.
That's interesting.
Amazing. Going on a different vein, when you're looking at your patient, let's say out of the millions of people that likely suffer from elevated heavy metals and BPAs, plastics, this is like the new buzzword, microplastics and everything, and what they can cause, what they can do to the immune system. I've found that therapeutic plasma exchange can be beneficial for some of those patients as well. Half of us walking around who eat a ton of sushi, especially here in Southern California, probably have elevated mercury levels. And, and it definitely, it makes you feel tired, and you have that brain fog, and you can get those aches and pains and random, these nondescript symptoms. Have you found any of your patients truly benefiting from those, or do you use other options for clearance?
We haven't used TPE personally in the clinic. I know a lot of other clinics that do for the specific purpose of chemical detox, whether it's metals or plastics, and I do know that it works very well for that. In our clinic, we're really more about minimizing their exposures going forward and then trying to enhance the body's normal detoxification mechanisms. Through liver support, essentially. Sometimes, sweating and other things can really make a difference there. But yeah, TPE, I think, for the clinics that do use it, that's one of the primary uses that I see in the functional medicine space. And it makes a lot of sense. I mean, if you probed your blood at any given day, you probably would find hundreds of chemical compounds in there, from, Roundup to plastics to, as you mentioned, metals. There's going to be a lot in there. So TPE, again, lifting that veil for a period of time would be beneficial.
Now, you've done a lot in this 8.5 years since you've stopped doing interventional radiology. Last time I saw you, actually were coming from a conference, and you give a lot of talks, and you speak at a lot of these different conferences, and you've written a book. Before we talk about the book, let's talk about just this last talk you gave. What was that about?
So it was a talk about, the conference itself was about the concept of immunometabolism. Essentially what we've learned really from COVID and long COVID in the last 3 years is that the metabolic state of the individual and the immunological state of the individual are one-to-one related to each other. In other words, people who have some type of metabolic dysfunction going into something like a COVID infection are much, much more likely to have an issue with the acute part of the infection, and also much more likely to end up with long COVID. My talk specifically was about the mechanisms involved there, which we've actually seen a humongous amount of research about in the last year. We've learned actually that they're not kind of general mechanisms. There are direct chemical messages that occur in a metabolically unhealthy individual that change the way their most advanced part of their immune system, like their T cells, function on a day-to-day basis. So it's a huge developing area of research, really fascinating, and more emphasis on why we all need to be healthy as much as possible day to day for the long term.
So is everyone going to be treated with the Ozempics and the Mounjaros to fix their metabolism?
There was a humongous amount of interest in the GLP-1s, obviously, in that discussion. One of the lectures right after me was David Perlmutter, who's a very famous neurologist, works a lot in the Parkinson's space. And GLP-1 agonists are being used a lot in that space. We use them a lot in the space as well, too. And there's some data in some of the early GLP-1s and now newer GLP-1s showing dramatic benefit in Parkinson's. So there's a lot of interest. I think, again, you want to try to maximize what you can for that person. So, you try to get them as metabolically fit with lifestyle as possible. And then when you're in a situation like Parkinson's where it's a progressive neurodegenerative disease, you want to do everything you possibly can. Yeah, you'll use a GLP-1 in that situation.
It's so interesting because more and more, unfortunately, my father had Parkinson's, and therefore it was more on my radar where people say, "Oh, I have Parkinson's," or so passed away from Parkinson's. It really is like, whoa. And I've realized over the last 10, 15 years, it's so common. And when we were in med school, they didn't make it like it was this incredibly common disease. No. You learn about Parkinson's, you went on with. Now it's like everybody's got it. So it's interesting that you say that. Easily can be a metabolic disorder that's contributing to it, or somebody may have an underlying neurodegenerative disease and it just gets worse because of it. So I feel like that'd be great. And if it's a simple shot that can kind of help it, why not, right?
For sure. I mean, you don't have any other treatment options that really do much other than, dopamine agonists.
Which are the worst too. I mean, you could take it for a certain amount of time and then it's kind of wears off.
Yeah, it wears off. You just have to keep increasing the dose. So yeah, I think, there are some really promising treatments in that space. There was a really interesting trial on a compound done by a company called Anovis. And because so many people are on GLP-1s right now, they actually found that their drug worked for stabilizing PD more for people who are on GLP-1 simultaneously than their drug worked alone.
That's amazing.
So I think we're going to see a real continued application of GLP-1s in the neurodegenerative space.
It's just the constant kind of adage that sugar metabolism is what matters in your body, right?
Yeah.
No matter what, whether you have for kidney disease or heart disease or neurodegenerative disease, it doesn't matter. It's all about how you metabolize your sugar.
Absolutely.
And it's really coming down to that basis. And then, so I'm going to transition from there to your book. And tell us why you wrote the book, what the book's about, and where we can get it.
The book is called When Food Bites Back. It's a book that I really wrote to try to help educate people about the way that what you eat can influence your specific autoimmune disease. And there are now very well understood mechanisms in which literally what you eat could be the trigger for you having an autoimmune disease like Hashimoto's or MS or other things like that. So it's really a roadmap for all the different autoimmune diseases that can occur in that space, what you do about it from a dietary perspective, tests to ask your doctor to run for you to help with that workup. And The reason I did it, wrote the book, and the reason I go out there and give lectures is because, quite frankly, there's a humongous need. We cannot keep up with the patient demand here in LA. As you alluded to, there's too few people who are MDs, allopathically trained, or DOs practicing functional medicine. There's a lot of other practitioners in the space, and we need MDs and DOs doing it because we can bring the whole spectrum to the treatment plan.
I completely agree with you. Just to me, it seems safer. At least if I was coming as a patient, I'd feel safer coming to somebody who is trained and can take care of everything. Now, I'm not putting down the naturopaths and others, but to me, if I really had an issue, especially an autoimmune disease, I want to come to someone who's a real expert and be able to treat me, especially if things go really wrong.
Yeah, I mean, that's the thing is I think you can, when you have that type of training, you can see it from multiple perspectives, not just one. And so having that degree, I think definitely helps.
Yeah. And in today's world, there's a lot of collaborative care too. Like we're getting referrals from a lot of rheumatologists, neurologists, primary care docs, and speaking the same language because we've gone through the same training. We look at labs the same way, we know the medications the same way. I think it's really important for collaborative care. Again, naturopaths, acupuncturists, chiropractors, they have their place. There certainly is nowhere near enough of the people practicing this as there is demand. So, but, I definitely want to encourage a lot more MDs and DOs to get into this space.
I find something to be very interesting. Not that I want to know about it myself because it's scary, but you have a way to test for the possibility or the probability of getting Alzheimer's. Or
yes,
and it's fascinating to me, right? Tell us more about that. Again, I don't want to know, but it's interesting because we did a bunch of genetic testing a while ago with a company called Human Longevity Institute. Mm-hmm. And one of the things they showed us was our lifetime risk of Parkinson's, lifetime risk of Alzheimer's. And when you look at it and it unfolds, you're like, oh no, please, I don't want that. Right?
Yep.
And so tell us what it is, what you do and the test and then how you counsel people, because it's kind of scary, right?
It's really difficult because I think obviously when you look at the potential way that you could live out the rest of your life, for many people out there, their worst nightmare is to end up with dementia. You almost die before you physically die. It's a horrible way. And a lot of people, because of the prevalence of dementia, have seen their parents or other loved ones go through this. So it's kind of like burned in the back of their brain as this traumatic experience that they just don't want to even talk about, right? So step one is getting people to talk about it. If you have a loved one in your family that died with dementia, you are by definition at an increased risk. So, does that mean that it's the road that you're going to travel? Absolutely not. Dementia, Alzheimer's disease, these are majority environmentally influenced disease with genetic predispositions, right? So step one is identifying if you in fact have that genetic predisposition. As you mentioned, ApoE4, whether you have a single copy or a double copy can determine whether you're a 1.5 to 2x risk versus a 6 to 8x risk, right? Those are scary things to talk about. But again, the most important thing is this is a risk that is modifiable via lifestyle. So you're better off finding out about it than just being blind, because you could have avoided the outcome if you knew ahead of time. So outside of ApoE4, there are a couple of other genes that you want to pay attention to. There's a lot of interest in something called clotho now, right? So that would, if you have it, would potentially protect you from ApoE4. So doing ApoE4 alone, I don't think is enough anymore these days. You really need to know your clotho variant as well too. And then there are some other things like, whether you have a IL-17 genetic predisposition, which is a pro-neuroinflammatory cytokine, a couple of other things that you can look at. But, once you identify what the predispositions are, that really just gives you a map of like, how aggressive do I need to be with my lifestyle? And we know from several trials that were done, mostly in Northern Europe, about the lifestyle interventions that are effective here. We know about the very basic biomarkers that need to be tracked, like homocysteine, LDL, ApoB, omega quantifications, basic stuff that anybody can do, your vitamin D levels. And we are seeing an absolute revolution in the biomarkers that are going to be used for early detection So probably already, we're making huge strides there because companies like LabCorp have blood testing where you can look at your phosphorylated tau, which has somewhere between, maybe a 75 to 93% sensitivity for detection of early Alzheimer's. So we're really moving very quickly in that direction. I think we'll continue to see a revolution in that space.
That's very impressive. 75 to 95%.
Biomarkers have dramatically improved in that space, right? So we've got to take our model for cardiovascular disease and apply it to Alzheimer's disease. There's no different way to approach this. We've got to break the barriers for having the discussions with patients, say it's not a road that you're 100% going to travel.
Sure.
You can do something about this. Don't be afraid to do the investigation, get the data, and do what you need to do to prevent it.
And most of the treatment is lifestyle.
Again, lifestyle is always, I think, the basics of the treatment. There are, again, pharmaceutical companies that are looking at various ways. There is one FDA-approved drug for Alzheimer's that they're trying to also repurpose as potentially preventative. None of them work as well as lifestyle. If you look at the data for lifestyle in prevention of Alzheimer's, it's dramatically effective.
But you know how hard it is to make patients follow those lifestyle modifications.
Yeah.
That's why these GLUT agonists are so.
There is newer technology that's going to be on the market. I think 2025 mid-year. It's a company called MiniCircle. They do reversible gene editing therapy, and they've already done multiple human trials on follistatin gene therapy, which for muscle mass, and the Clotho is next. And so that one is currently in phase 1. They're about to advance to phase 2. But I think they're in phase 2. They're about to advance to phase 3. Once that's done, it still might be tough to approve here, but a lot. That's why people are going overseas because they can get some of these therapies. But obviously, lifestyle is first. And then after that, you can compound. So especially people who are, let's say they have the 2 alleles of the gene for the ApoE4, they may consider doing something like this to help neuroprotect.
Yeah, absolutely. And let's kind of bring it back to the stem cell discussion, because I think that's another very interesting space that we're seeing application, Alzheimer's and Parkinson's both. And there's at least one company that I know of in Texas that's in phase 2 trials for Alzheimer's and Parkinson's with mesenchymal stem cells, cultured, banked, repetitive mesenchymal stem cells. So,
just IV?
Just IV, 200 to 240 million per infusion.
It's great.
Somewhere between 5 to 6 infusions over the course of 32 weeks, and then they judge the results at 52 weeks. They just released their phase 2 in MS, which was overwhelmingly positive.
That's amazing.
Yeah.
There's, the space, the stem cell space is really just starting. We haven't even cracked anything. The barriers are so tight, especially around here, that once we get a little more leeway to do things, I think hopefully the sky is going to be the limit.
Is that Celtex?
Hope
Hope
Biosciences.
Wow.
Now thoughts on here. Once you find out about the Alzheimer's gene and all of that, any role in TPE with that?
I haven't seen it used. You know what? I think a little bit about the reason for that is that it's typically a much older population, though there are caveats to that, because we see, especially in our clinic now, we're seeing a lot of younger people, both with PD and Alzheimer's. I mean, I've got a 44-year-old with PD in the practice. He's had PD for 6 years, and that's not genetically driven PD, right? So about 1% of PD, about 1 to 3% of Alzheimer's are purely genetic. There's nothing that anybody can do about it. This gentleman is not in that category, right?
Yeah, it's interesting. That makes me very happy. I actually called my dad's neurologist as soon as he was diagnosed. I'm like, what are the chances of me getting this? He's like, very low.
Yeah.
Don't worry. This is not a genetic disease. So then you think to yourself, and that's all I kept thinking over the last 15 years, is why did he get it? Right? And like you said, it's mostly environmental. You don't know why someone gets Parkinson's.
No.
And that's one of the hardest things as a physician. It's amazing the space that you're in, because autoimmune disease is very similar too. You just don't know why people get it. Now, some of the things that we have genetic predispositions for, we understand. You're just unfortunately out of luck, and it is your fate that you had it genetically. But a lot of these, they're not there. So
I just wonder if it goes back to chronic, again, we're thinking chronic inflammation causing these neurodegenerative changes. Does therapeutic plasma exchange reduce that inflammation? Yes, it can. Is there any, published data out there? Probably not. But I'm imagining with the huge increase in PD that ultimately these are going to be the next in the form of testing. So
PD's theorized to be autoimmune in nature. Maybe with dopaminergic antibodies, blood-brain barrier antibodies, so there's a lot of postulate, and I think people are kind of narrowing that down a lot. Maybe PD is entirely autoimmune. So you could see why there would be benefit there for sure. Alzheimer's, definitely a chronic inflammatory process, no question about it. It's a chronic inflammatory process that went on for 15 or 20 years unchecked. So yeah, you of course would lift the veil on that.
Interesting.
That's really interesting. We're going to have you create a study for some of these patients and have them come do TP.
I'd love to.
I mean, that's the way to go.
Yeah, I'd love to.
Now, just to go to really kind of pick your brain, one last thing before I really let you go. One golden nugget advice you'd share for anyone wanting to improve their health.
I'm very big on the basics. People come in and it's always about the fancy things, and
Right.
Again, we do all those because they help. But there's so many times that it's just like, you're not moving, you're eating crap, you're not being conscious about all the things that we should be. Like, in my opinion today, nobody should ever be popping a plastic container into a microwave and heating something up, right? But it still happens. You should never be cooking something in an aluminum container. You should never be cooking with nonstick cookware. There's so much data there in that space that those things should be just gone. But that information hasn't trickled down yet.
Education.
So yeah, I hit the basics with people as much as I possibly can, right? After that, it's take care of your immune system as much as you can. I think it's your gatekeeper. It is the thing that controls whether you're going to get disease, what your phenotype of age is going to look like, so give your immune system a lot of love. I think everybody should be taking some type of immune support on a daily basis, in today's world, especially where we're just getting bombarded with viral infections.
Such as?
Vitamin D, vitamin C,
Perfect.
NAC, zinc, quercetin. I would call those all like everybody should be taking those on a regular basis.
And for someone to come and get in touch with you or come see you in the clinic so they can actually have you set all this up.
Yeah.
How can people find you? How can, where is the clinic? Tell us more about
the clinic is in Brentwood, Los Angeles. It's called Regenera Medical. Website is regeneramedical.com. All the information's on the website. If you live in California, we're happy to see you. You don't even have to be in Los Angeles, so just give us a call.
And do you do virtuals too? Like
do.
if someone wanted to kind of talk to you from some different state or different country and really wanted to get in, because we do a lot of virtual stuff, and then once we get to know the person, they'll come in if they need to.
Yeah, we like people in person for the first appointment because there are some data points that need to be, let's say, drawn in person and shipped overnight for lab analysis, and it's just really too difficult to do outside of the clinic. So we like people in person for the first appointment, but yeah, after that, virtual is possible.
It's amazing.
Amazing. If you like this video, you're going to love this one.
Soldiers get shot up, they can either inject themselves with a ketamine pen or a morphine pen, actually. And what's fascinating is that the soldiers who injected themselves with ketamine pen never developed PTSD.